Hey guys, it's Callum with Holistic Foot Clinic here. And as spring comes in and weather starts to heat up, we're going to talk about ankle injuries. Now this is something that can happen obviously during the cold weather when muscles are stiff and people still wear unstable footwear, high heels per se. But as things start to heat up and everyone's running around a lot more, a very common thing that happens is ankle injuries. Now, while we will focus throughout more videos on how to deal with it on the day, medium term, and how to prevent things long term, today the main focus is actually going to be talking about the anatomy of the ankle and what type of injuries people can actually get, because sometimes people aren't sure whether they've hurt a muscle, bone, or something more scary. Hopefully nothing more scary. So when we're looking at the ankle, it's good to establish what actually makes up the ankle. So most people tend to think of it as the lump on the inside and the lump on the outside of that ankle region above the foot. Really, we're dealing with three sets or three bones. So the large bone that runs down your lower leg, you would call your shin, otherwise known as your tibia, and the one that runs right beside it, a smaller bone, which is the bump on the outside of your foot, okay, known as your fibula. Those make those two bumps that make up the typical ankle, and then running right below them, there's a overall smaller but wider coverage bone called the talus, and that sits above your heel bone and below those two bones of the lower leg, and that pretty much makes that typical ankle pivot sort of joint. Now, common movements of the foot that happen underneath the ankle is this inversion sort of movement, and then this outwards of the foot, which isn't as intense, but the foot pretty much can go out and tuck in. Those create the two most common injuries, right? We'll see people typically walking, and when you think of someone rolling their ankle, probably the most common you'll see is this sort of roll in as your foot comes out, the bone comes out. So when someone's walking, they're going to step and go, whoa, and then you get that rolling into the bone there. And in reverse, of course, you can get, although it's harder to represent it here, the opposite, where the inside of the foot rolls in and comes out like that. Or, to be extreme, step out, whoa, okay? And you're going to do a few things there, and hopefully nothing too bad, but at the very least, you're going to strain muscles that tend to run down under the ankle, and as this rolls down, they quickly jerk up. Those muscles can get strained, and the ligaments that join bone to bone, there's multiple here, can get strained because it's such a sudden force for it to deal with. And that can also happen obviously on the other side. So when you think of someone saying a sprain or a strain, that's usually going to relate to either the muscles, the ligaments, or both in the area. So that's all soft tissue that can be healed, but you might have to take it easy. A bit worse is if the bone, obviously in that area, either hits something, and sometimes people think of a heel injury as an ankle, but either way, hits something and then gets worse, or the ligaments and tendons which grip onto the bone in this sudden roll and twist to correct, sometimes that pull can also dislodge or damage a bit of the bone there. Those are really the three main things you're looking at. There are some other concerning things that can pop up, but in general you're worried about fractures, any kind of damage to the bone, or ligament and muscle strains and sprains. Okay, so some people do get caught up on Achilles or kind of calf to back of the heel as an ankle injury, and it is at that level of the ankle, but usually when we think of Achilles injuries, we're not necessarily thinking of ankle. The most common you'll get, especially during sport, is this rolling in and rolling out. So putting any other wacky kind of symptoms aside, this is the main sort of ankle injury we're looking at, and these are the main sort of injuries that we're going to discuss further in terms of how we treat it short term, so on the day, how we can work through it to rehab it to a healthy state, and then what we can do to try and prevent that in the future. If this is a problem for you or anyone else you know, you can always check with your podiatrist. Hopefully that's Holistic Foot Clinic if we're in your area. Otherwise, stay listening guys, keep walking, and we'll go over the rest coming up. Take care.